So my next topic is satellite education model, work-orientated professionals for healthcare by distance learning method. And as I said in my previous presentation, there is many changes now going on, and we need new education models and new ways to educate at the moment. In Finland, we have a such kind of system that the government program and government action plan, they are steering and financing our activities of higher education. And there is several missions, and missions for us are that higher education should connect higher education and work life. We should have a close collaboration with the work life. And also we should enable studies in authentic working environment. And all those education should be based on the demands of work life. And one very important issue is also that this education must be available to all people, regardless where you are living at the moment. And the digitalization, of course, it's the focus. And all this means that we need a new education model, and we have to reform our education. So as I already told a bit, this our education model, you can see here this model. So the main campus in Kuopio, and then we have those satellite campuses. Students have own campuses in the contents of hospitals, and theory lectures goes via Zoom video connection, and all practical training is inside the hospital laboratories. And we started this model 2014 in our degree program of biomedical laboratory science. So we were really the first ones in Finland at that time. In this picture, you can see a bit what does it means. So in left hand, you can see a picture from Kuopio, the main campus. There is the students, and teacher is sitting in front of a classroom, and then all those theory lectures will go through Zoom video connection to the satellite students on 2 satellite campuses. So they can communicate and talk about with us, and it's really an interactive situation. Nowadays, we have a bit modern and better facilities than in these pictures here. Then what are the benefits of satellite education? If you don't have an own education, you can use this satellite education model, work-life oriented education. If you have a shortage of manpower, you can educate by this model local citizens or local needs. If unemployed persons need re-education, this satellite education model is very flexible to use in these cases also. And nowadays we have less resources in education and also in work life, and maybe there is not enough places to practice. So this is the win-win situation for both of us when we work very closely with work life together with education. So here I have shown main steps how to set up this kind of satellite education model. First, of course, you should negotiate with work life. You have to evaluate their facilities, what kind of equipment, rooms, and etc. Then you have to make some decisions, agreements with work life, and you have to set up steering committee, which is following the process. And before you start this kind of education, you have to train your teachers, mentors, students, and especially IT support is very essential in this model. And if we think about those responsibles for University of Applied Sciences and work life, so we as an educator, we are responsible for the education, which based on curriculum. We follow EQF 6 level, national professional competencies and generic skills. Whereas work life, they are responsible to arrange all these learning facilities, classroom inside the hospital, equipments, regions, and etc. Then if you think about this funding, so we are covering our cost by basic funding from Ministry of Education and Culture. And Worklife responsibilities and duties without any compensation from us. So there is not any money transfer between university and Worklife. In this article, the aims and objective was to describe those experiences, what we have from different perspective of students and teachers. We also wanted to describe experiences in general, what we have gained during this satellite education, and also describe the significance of this model for society and work life. And also we wanted to tell a bit how we are further developing model in future. If we think about from teachers' point of view, this model, teachers think about that you really need good orientation at the beginning. After this orientation and you know all those technical issues and equipments, learning will go on routine. And they also think about that satellite students, they need more guidance and encouragement at the beginning, because this is not a new model. It's not like in classroom teaching. And teachers think about also that students, they must be self-directed and self-initiated. And with this cooperation, it will be very close between work life and also with the students. Then from students' point of view, our students, satellite students, they think that it's very nice to study because they can study time and place independently in their home community. They don't have to move to Kuopio. And then they also think that this model requires a bit more. They should be self-discipline and self-orientation. And as teachers said, they think about also that they need really good orientation at the beginning and support from teachers and the organizations. And this model, it gives a deeper and broader knowledge and understanding of healthcare system and work life, because now they are working in authentic work life environment. And what is the best thing is that all our students, when they graduate, they are employed by Worklife, because on that area they have a shortage of manpower. This is really a win-win situation for all of us. And then if you think about from Worklife point of view, this is now the solution to shortage of manpower. And now when they are inside the hospital environment, inside the work life, they have a better knowledge and skills, so they don't need so much familiarization at the beginning. And of course, local persons for local needs. And it means at the same time that the persistence of workforce is much better. They will live and work there where they are living. From the society point of view, the satellite education give possibility time and place independent education. It's very cost-effective education, and it's also support adaptation to digitalization. So as a conclusion, this model, it really improves the quality of education. It supports digitalization. Now we are connecting to work life and education very closely. It enables studies in authentic working environment. And now we follow all those demands and changes in work life, what there happens. And it enables education to all people, regardless if you are living in Lappeenranta or in Kuopio or in Lapland even. So, and also in this situation where we are now, this is really good model to use. So some future visions. So as you already saw my last presentation, this future to project is enriching and further developing this model. We will add also VLEs to that model, and we will use these new technologies. And that one, what I want to say now, this satellite education model is, and these new solutions, you can apply to all kind of training and education. This is not only for healthcare education, like now here, this our situation, but it's for different kind of fields, regardless of field study. So thank you for your attention. If you want to take a contact, here is my contact details. So thank you.